I don't think it would have been near as difficult to unravel my OCD and find a path forward had I not been dealing with it for so long without professional assistance. I'm Brian McFerron. I am currently a pediatric gastroenterologist at Riley Children's Hospital. I'm also the program director for the Pediatric Gastroenterology Fellowship. I've been a worrier since I was 5. I think that for the longest time, I thought my worries, and I think my parents thought my worries, were secondary to applying to medical school or back in high school even, wanting to make sure I got into a good university and then performing well in undergraduate so I could get into a good medical school. And at each step of the way, I thought that the excessive worry and anxiety would dissipate as I achieved that next level. 14 years later, from college to the end of fellowship, I had this expectation, a false expectation in my mind, that the excessive worry would stop. And when it didn't, I think that was a significant gut punch to me as a junior faculty member, as a young father and husband. My wife was critically ill following the birth of my son and nearly lost her life in front of my eyes. And after that, I think I was strong for a couple of months, recognizing that my wife was recovering and is healthy now. But for those first couple of months, trying to be the strong one, support her while she healed, and then also, oh, by the way, have a 2-month-old. After that, completely unraveled. I felt like I was walking around in a fog because I was so overcome with intrusive thoughts. Struggled with nightmares of witnessing her near death in the emergency department. That ultimately is what led me to seek help after all of these years. My excessive worry and rumination and intrusive thoughts that for years I thought had been related to applying to undergraduate, applying to medical school, residency, and the like, were actually much more consistent with a true anxiety disorder, in which case for me is obsessive compulsive disorder. Learning about my obsessive compulsive disorder and learning about how best to treat it took some gut-wrenching work. I think that cognitive behavioral therapy in that space, as it relates to obsessive compulsive disorder, particularly exposure response prevention, it is a lot of work and it is exhausting, and I wanted to give up multiple times, to be honest. It took a number of years of dedicated treatment after diagnosis of OCD, and a lot of support from my wife, who's a very patient woman, but clearly wouldn't be where I am today without her. And then my psychologist, she's a friend, she's a coach. When I was a kid and looking back, realizing that these symptoms have been present all along, no one talked about mental health conditions at all. Care for mental health conditions was absent, particularly in rural communities like I grew up in. I know that I suffered in silence for 3 decades and didn't want to mention it for fear that others wouldn't understand, because it's not something you can show somebody on an x-ray or show them on a blood test. I didn't tell many people throughout that time, especially when I was in the midst of my medical training, not something I wanted to mention as I was going for licensure. Obsessive Compulsive Disorder is part of my story. It's part of who I am. It's something that I manage. It's made me a better physician, a better father in a number of ways. I certainly have bad days like everybody else, but it can be successfully managed. For so long, mental health conditions have been stigmatized, poorly understood from those who don't suffer with them. That is starting to change, thankfully. Removing the roadblocks for obtaining a medical license, for proceeding through training, in my mind, is potentially life-saving. You're talking about conditions that raise rates of depression and suicide, and not obtaining appropriate treatment for years, sometimes decades, for fear of not being able to achieve your dream can be life-threatening. So many people now recognize that you do want the people who are willing to come to grips with the fact that they have a particular condition, for me it was OCD, and that these people manage it. That's what counts. IU School of Medicine has those programs available, allowing people now, even early medical trainees, to get on top of their condition. I think the fear of not being able to renew my medical license or having a license revoked is gone now. After a number of years, I've read a lot about vulnerability, and vulnerability doesn't mean opening up your entire life and tearing down all professional boundaries, but being vulnerable as a father, being vulnerable as a husband, as a physician, as a medical educator. In all of those areas of my life that are an important part of who I am has enabled me to help others, personally and professionally. And that, to me, is the true zest of life. I found myself sharing my own story with trainees in person, in smaller groups, as a panelist at different meetings. The more I got into education and realized how much medical trainees actually suffer. The ability to share and be truly vulnerable opened up conversations for others to experience the psychological safety to share. Really eye-opening for me, and in my mind, one of the most important things that I can do as a medical educator. We have to care for our healthcare workforce. Doctors, advanced practice providers, nurses, and all types of allied health professionals provide better care with better outcomes when they are well. Managing and successfully managing your mental health condition so that you are performing at a peak level is the ideal state. Get help when you feel that you need help. Don't suffer in silence like I did for 3 decades. Don't wait. I don't think it would have been near as difficult to unravel my OCD and find a path forward had I not been dealing with it for so long without professional assistance.